So hello all, my name is Sharon Bacalash. I'm an eye surgeon by trade and the CEO of SB Strategic Development Consultants. I'm here today with Dr. Ranya Habash, who's an ophthalmologist, fellow ophthalmologist, a woman of all trades, the Renaissance woman of ophthalmology. And I would love to learn more about what she has been up to lately and all the different hats that you're wearing currently. So let's start with that.
Okay, well, it's great to be here with you, Sharon. I'm a big fan of yours, and you just rocked your panel just now. So thank you for having me. Thanks for the interview here. I am doing a lot of things, just as usual, because when you're just really passionate about medicine, you can't really say no to anything. But that's not really true. I mean, I take on things that I feel have a lot of value and will actually change the world, that have a big impact. And so it keeps me very busy, but that's the way I like it.
That's the way to go. So let's talk a little bit about MetaMed. Where is MetaMed standing now? What are you guys looking for? Where does MetaMed finds the current situation in the ophthalmology microcosm?
Okay, yeah, great. Well, MetaMed was a little side project, really, at first. But this thing, I mean, I am literally trying not to spend too much time on it, but it's impossible. I mean, everybody wants a piece. Everybody wants to be involved. And it's because we've shown real value in the metaverse. And right now, everyone thinks the metaverse is really just for gaming and social media, but it's not, and we do these amazing things. We've built some incredible things already. For instance, every single week, we do Retinaverse rounds, where we invite KOLs from around the world to share 3D surgical cases. Wow. They show their surgical cases in 3D, and all these other KOLs show up, and they show up as avatars. And so everybody's sitting there in the crowd, as an avatar on a space station, which is the auditorium that we built on the space station. And we have representatives from all the major institutions in the country and some from around the world. Now we're starting to get medical students and residents from all over the place who are coming in as well. It's been incredible. I mean, people, just the greats in the industry sharing their surgical cases and doing, surgical education and mentoring for others, all in the metaverse. It's fantastic.
It is fantastic. Yeah. So I also know that precision medicine is one of your passions. Could you tell us a little bit more about that avenue that you're pursuing?
Yeah, to me, precision medicine is the future. We weren't able to do it as much in the past because we didn't have the computational power, the sophistication with algorithms and that sort of thing. But now we are. And so, precision medicine or predictive analytics, digital twinning, all of that was already being done in other industries forever, manufacturing, the auto industry, et cetera, financial industries. But it hadn't been really done in medicine yet. I'm going to change that because, going back to your session just now, I mean, the best way to do neuroprotection is prevention. So,
right.
You can neuroprotect all you want, but, if you have the opportunity to detect disease in a patient and predict disease progression, then you can go back and take the measures that will keep them from ever developing it in the first place.
And so in what areas of ophthalmology are you looking for this precision medicine aspect of?
Yep. Well, glaucoma is a really big one. As you know, glaucoma is so multimodal. We have to sit there in the clinic with a patient and synthesize all this information at one time, which is fine. But that's what algorithms are for, right? That's what computers are for. They help us to kind of bring all that information together. But then going further than that, a patient is not just their eyeball. They are a composite of everything that makes them who they are. Microsoft actually just came out with a study recently that said, which is more important, your genetic code or your zip code in determining your health? Actually turns out it's your zip code.
Yes.
Because where you live affects how you live. And so that actually makes up a greater chunk of determining where a patient will be in 15 or 20 years with their disease. My answer to that is, what's even better than the two alone is the two together. So now combining clinical data plus genetic data plus lifestyle data, social determinants of health, et cetera, now you really get a feel for where a patient will end up and the best way to treat them for different things.
And is this what you're doing right now at Avellino?
Yeah, that's what Avellino is all about. I mean, they're the leader in genetic testing for the eye. So just starting with that, I mean, they all laugh at me when I say this, but genetics is the DNA of precision medicine. You can't do it without the genetics. And they've already figured that part out. They have the data analytics. I'm coming in to help improve that and to do almost, to pull in different sources of information. So now the clinical data, the imaging data, and then the pharmaceutical data as well, so we can predict who's going to do better with certain drugs than others.
That's great, specifically in the field of glaucoma, where current studies are focused only on IOP. they're actually facing huge sample sizes with long-term follow-ups, and they're often encountering very indecisive results, considering they're taking open-angle glaucoma, which we all know is a syndrome, is not one disease.
Exactly.
So I
Yes.
think that makes a lot of sense.
That's why I loved your panel, because we were speaking exactly the same language. You really get it.
Well, I'm really excited about that, because right now, to the traditional cohort of neuroprotection companies that have been around, there's an additional sidewind or backwind from gene therapy, cell therapy, genetic testing, and that kind of like brings to the surface the need for precision medicine, the need for algorithmic selection of patients, and I think that that'll, at the end of the day, create much more innovation in the field once it's approved by FDA as valid endpoints.
That's exactly right. I mean, look, it could even be a companion for right now, in use along with the other machines that we use. But this is the future of medicine. I mean, this is the real exciting thing. That's what gets me out of bed in the morning, knowing that we have this potential to change medicine in our hands. And we're standing at this tipping point right now, like you said, where we're at the forefront of just changing the paradigm of how everything is done.
Right. Completely agreed. I want to switch gears for a minute. We all know the current microcosm of investments is very challenging and has been challenging for the past year. What kind of advice do you have as somebody who stood on the other side of the fence for entrepreneurs in the field that are facing those challenges?
Yeah, thank you for that. That was a tough period. I still think and I still maintain that the cream rises to the top. And a lot of times in these bad times with investing, I still think that the good companies and the good ideas will still rise to the top. They'll shine. It's almost like the bad stuff falls away, and then you have the good things left over. Certainly, mine was a good thing as well, but I still couldn't. I don't like this question.
You're editing us.
I know. It was still a really tough situation. Look, I mean, I would just say the best advice I can give is something that somebody told me a long time ago. The bad news is nothing lasts forever. The good news is nothing lasts forever.
I agree with that. And yet, considering we are at OAS, and this is the first time we're having 2 full days of OAS together, what are your thoughts about how this venue specifically can progress or can advance young innovation, budding technologies to move forward despite the situation?
Yeah, thanks for the softball question after the last one. But, when you get a room full of entrepreneurs, investors, all the clinical leaders in the field, I mean, that is just a perfect recipe for innovation, and so we've heard about stuff today. I mean, I like to think I'm pretty in the know. I have my finger on the pulse when it comes to new technologies, and I've been surprised by new things in the field today. And that's amazing. I love seeing that. I love seeing where things can go in the future, and having people who are not even from our field there sometimes, and they have newer ideas, newer ways of thinking about things. And that's really refreshing. So I'm all for forums like this.
Yes, I agree with you. Today was a great showcase of both forums of venture capitalists that gave advice, of people with huge amount of acumen with regards to making deals, developing technologies, as well as an opportunity to see small companies, small startups that are just starting to see, even if they are newcomers to the field. So that was very refreshing. I agree with you. Well, thank you very much. I appreciate the time and the energy, and I look forward to more.
Oh, definitely. Thank you so much. I really appreciate it. And, it's an honor to be here with you. But
Same here.
I feel like we could talk for hours. So thank you
Yes.
so much for this opportunity.
Thank you. Bye.